Okay, so I did my internship this year at Wheeling Hospital, specifically in the emergency department. I didn't really have a direct supervisor. I kind of had a boss that managed scheduling and stuff along those lines, but mostly I would say my supervisor, if you will, was more or less the doctors themselves. Um, and this internship was really good. You got to work firsthand with the doctors, work in and around the nurses in a setting that's always going, always busy. There's always something that needs done, it seems like. I didn't really have a lot of hands-on activity per se. I mean, in a way I did, but not working directly with patients. I was more or less going with the doctors to see patients in their room and taking notes of what the patient's complaints were, what was going on that day that led them to come to the emergency room, and then after seeing the patient, writing down what the doctor noted for a physical exam or also the review of systems, which is stuff is along the lines of like, if someone comes in and they say they're vomiting, you add that to the review of systems. If they have diarrhea, you add that to the review of systems. And then the physical exam was more like what physically was wrong with them, like what the doctor found on that person. And I personally feel like I learn best in settings like that, settings where I'm seeing what's going on with the patient, seeing how the doctors are handling this, seeing what the nurses are doing to go along with what the patient's describing is wrong. And so I really enjoyed this internship. I thought it was really good for me to work in this department and see what it was really like working in the medical field and see if that was something I wanted to do going forward. But like a typical day working in the emergency room, it's a 24/7 operation there. So your hours could be, I mean, I've worked midnights at the hospital. I've worked 7 p.m. to 7 a.m. through the nights, but mostly it's 10-hour shifts. So that would either be 6 a.m. start time to 4 p.m. in the afternoon, or 4 p.m. in the afternoon to 12, and then, or sorry, not 12, to 2. So 4 p.m. to 2 a.m. would be what we normally worked, and then there was a little gap in there. Unless the doctor working needed to scribe them, we would have somebody fill in. But when I first started, it was all 8-hour shifts. That's all it was. So it was 2 to 10, 2 p.m. to 10 p.m., 10 p.m. to 6 a.m., 6 a.m. to 2 p.m. was what I worked a lot of when I first started. But I've been doing it for a year, so I've worked pretty much any hours, any holidays you could imagine. One thing that really stood out to me while doing this internship was just like how you really truly never know what to expect when you go in for a day of work. Like, I mean, you could go in one day and see nothing but cough, cold, flu, stuff like that. And you could go in the next day and see nothing but traumas, high level incidents, accidents that are coming into the emergency room that are critical at the time being. But that's one thing I like, because you never really truly know what you were going to see. And that's something that I really enjoyed about this internship. Some things I didn't like about the internship, there was a lot of downtime, especially if the doctor you were working with wasn't using a scribe. I would say there's a handful, so there's probably 4 or 5 doctors that don't use the scribe at the emergency room, and if you're working with one of them, then it can make for a really slow day because you're not really doing anything. You're just kind of sitting there. That was really the only complaint I had. I mean, for the most part, it was really good. It was a good learning experience. I felt like a lot of the stuff I was learning in my classes here at West Liberty helped propel me to be able to do my job better, with a better understanding of what the doctor was telling me, what the patient was telling me, what we were looking at. But as far as takeaways from this site, I think that it kind of made up my mind. I've always had a passion for working in the golf industry, and I think seeing what it was really like to work in the emergency room and seeing the kind of dedication it takes and to work in a setting like that, and the stuff you see in a setting like that, is just not something that I could see myself doing going forward. And that's not saying that I wouldn't want to work in like as a physical trainer or an athletic trainer or physical therapist, something along those lines. But I just can't see myself working in the emergency room or even a hospital setting moving forward. But honestly, if for anyone that's looking to go into the medical field, I would highly recommend doing something like this. Even if you're not working in the emergency room, even if you're just working for a doctor outside of the emergency room and you're doing scribing, it is really good to get your feet wet in the industry. I mean, you see everything. You get to experience everything while you're not doing hands-on stuff. The doctors are working with you. You're seeing what their everyday experiences are like. You're seeing how the hospital runs on a day-to-day basis. And I really thought that for anyone interested in the field, this is a great opportunity to get your feet wet in the field and see if this is really what you want to do. As far as the site fitting into the bigger picture of exercise physiology, I don't know that it has any like truly direct correlation with as far as like working with patients, but like I will say, like I said earlier, a lot of the stuff I learned in our classes here at West Lib was stuff that I was able, that gave me a head start when working in the emergency department. From the anatomy classes I had and listening to doctors talk about that stuff, that was one that it was nice to have a little head start. And even some of the other classes, I know I did one last year that talked a lot about different type of conditions and diseases and conditions that people could have. And I've seen some of those that I saw in there and learned about were conditions I've seen in the emergency room. And I've seen just about everything you can imagine in an emergency room. So I think that while this isn't like a direct hands-on doing a lot of the stuff that we're practicing in the clinic when we're practicing exercise physiology, there are a lot of similarities between the major here at West Lib and working in the emergency room. But so, I mean, that was pretty much my internship. Like I said, I've been doing it for a year. I would highly recommend it to anyone looking to get into the medical industry. I think it's a great way to get your feet wet. One of the head doctor at Wheeling's emergency room started out as a scribe in the Wheeling's emergency room. So, I mean, that just goes to show you right there. It's a great way to get your feet wet, see if this is something that you really want to do going forward. And yeah.